we ready? Well, good afternoon. Thank you all for being here this afternoon. Earlier this afternoon, the Iowa Department of Public Health and the State Hygienic Lab confirmed Iowa's first 3 presumptive positive cases of coronavirus. First and foremost, our thoughts and prayers are with the individuals and their families, and our priority is their full recovery and doing what's necessary to contain the virus and protect the health of all Iowans. While this news is concerning, it's not cause for alarm. The most important thing that we can do right now is to remain calm, understand the situation, and stay informed in the days and weeks ahead. We are committed to transparency and keeping the public informed. What I can share with you now is that 3 individuals who tested positive for the coronavirus all live in Johnson County and recently were on the same cruise in Egypt. None required hospitalization and are recovering at home in isolation. We're still in the early stages of gathering all the information necessary to fully assess the situation and prepare for the next steps. And as soon as we know more, you'll know more. As the number of positive coronavirus cases has been increasing across the nation, we've been proactively preparing for the likelihood that it would arrive in Iowa. The Department of Public Health has been planning and assessing resources across hospitals and with healthcare providers. In addition, they have held informational webinars for healthcare providers, schools, businesses, and other organizations to help ensure Iowans are aware and prepared. State departments have been assessing their operational plans to prepare for continuity of services. And earlier this week, I directed the State Emergency Operations Center to partially activate in preparation. Given today's developments, I have ordered that the SEOC is now fully activated so that we can coordinate a statewide response to best meet the needs of Iowans during this time. With me today are leaders from Iowa Public Health, Homeland Security, and the Iowa National Guard, who will provide more information about the situation and answer your questions. I want to thank them and their teams for all that they've done and all that they will continue to do to monitor and manage the developing situation. In addition to the work we're doing at the state level, we are also engaged at the federal level through the President's Coronavirus Task Force that's led by Vice President Mike Pence, and we are in contact with other governors and leaders in our neighboring states and across the country that are actively managing coronavirus cases as well. I want Iowans to know that I am confident we are prepared, that we take this situation seriously, and we will manage it responsibly. I ask the same of every Iowan. The most important thing that you can do is to stay informed, know the facts about the virus, how to prevent it, and what to do if you are sick. So now I want to introduce Director Claybaugh, who's the director of the Iowa Department of Public Health, and he will provide some additional information about today's developments and what we can expect going forward. Dr. Claybaugh?
Governor, thank you. Good evening. As the governor mentioned, today we became aware of a presumptive positive COVID-19 test for 3 individuals who were all on a cruise in Egypt. The cruise ran from February 17th to March 2nd, and all 3 of these individuals returned to their residences in Johnson County on March 3rd. Upon feeling ill, all 3 individuals sought care at a healthcare facility, were evaluated, had mild illness, and were appropriately sent home. The 3 are currently isolated in their homes. Public health and healthcare partners are doing what they're trained and equipped to do to protect patients, themselves, and the community. As of today, we have approved testing for 37 people through the State Hygienic Laboratory. Of those 37, there are the 3 above mentioned positives, 26 negative tests, and 8 tests that are pending. We would expect pending tests to be received tomorrow. The Iowa Department of Public Health regularly works with local public health partners and healthcare providers to conduct investigations into outbreaks of infectious diseases in our state. My staff is currently in the process of working with these patients and their healthcare providers to understand the history of exposures for these 3 COVID-19 patients. This work will enable the department to implement necessary public health activities to mitigate the spread of COVID-19 disease in Iowa. While this particular investigation is unique due to the international spread of the virus, Infectious disease outbreak investigations are a routine part of the public health work. As our investigation reveals additional details about these cases, our department will continue to share messaging to protect the health of Iowans. We will work diligently to determine whether there is anything specific Iowans need to do to keep themselves healthy. It's important to understand that the identification of these 3 cases at once will take time for us to begin our investigation, evaluate, and that will take time. We do expect more cases will be identified in the coming days and weeks, and will continue to communicate as those circumstances arise. In addition to working with local public health agencies to gather information, we will continue to work with our federal partners, continue partnering with the State Hygienic Laboratory at the University of Iowa for sampling and testing of additional potential cases that are identified. I'll now turn things over to Dr. Caitlin Padati, our State Medical Director, to provide a little more information.
Thank you. I want to start by acknowledging, of course, that it's unfortunate that we've identified COVID-19 cases here in Iowa, but as you've heard from Governor Reynolds and Director Claybaugh, this is something that we've been working to prepare for a while. I also want to take the time to say that we all wish the affected individuals a speedy recovery, and we're going to continue to be supportive of them through the coming days as well as of their community. Again, as you heard from Governor Reynolds and Director Claybaugh, the Iowa Department of Public Health has been working closely with our partners throughout the state to prepare for how to identify and investigate these kinds of patients. And we're going to continue to do this kind of work in the coming weeks for COVID-19, as well as for a variety of public health issues like we always do. Again, as a reminder, when we talk about COVID-19, this is a newly identified virus that was first identified in China in December of 2019, found to cause fever and respiratory problems, and has now demonstrated spread from person to person in a variety of jurisdictions across the globe, including, unfortunately, here in the United States. I also want to emphasize that when we talk about this virus, there's a lot we don't yet know, and we're continuing to learn and continuing to work with our partners to learn more. There are some things we do understand. We think that this virus is spread through droplets, which means an infected person who might cough or sneeze, and then liquid droplets would land in the eyes, mouth, or nose, or even be inhaled by somebody nearby. And so that's why we give a lot of the public health advice that we continue to offer when we talk about things like washing hands and staying home when you're sick. In a time of uncertainty like this, I know it can be difficult, but I want to encourage Iowans to remember that there are a few important things that you can do to stay healthy and to stay informed. As simple as it sounds, we really want you to remember to wash your hands frequently with soap and water for 20 seconds. We advise that you do this often, and particularly before eating or touching your eyes, mouth, or nose. We also want to reinforce that it's really important for a variety of reasons to stay home from school and work when you're ill. That will help prevent the spread of many types of illnesses. And finally, we want you to stay informed. We want you to know that your local and state public health partners are going to continue to work on this evolving issue, and you can visit our webpage as well as reach out to some of the contact lines that we'll be describing for you, including a 211 call center that we've set up for the public. Thank you.
Good evening. I'm Joyce Flynn, Director of Iowa Department of Homeland Security and Emergency Management. As the Governor mentioned, we will be notifying state agency partners later today to report to the State Emergency Operations Center tomorrow morning, where we will begin and continue that planning effort that we have done. The facility is for face-to-face coordination and information sharing with all of our partners in support of local jurisdictions. That resource coordination is vital, and we do all hazards planning. When we are supporting those local jurisdictions, we are looking at things such as materials, supplies, personnel, and equipment. And the National Guard is one of those key partners because they have a lot of personnel available to them. I will turn it over to Adjutant General Ben Carell to talk about the National Guard partnership.
Good evening. I'd like to assure the citizens of the state of Iowa that the Iowa National Guard is trained and prepared for all hazards response. I've been engaged with other states' National Guard leadership across the 54, and we have been focused on their best practices, specifically those states that have been hard hit by this virus. They have shared with me their best practices. They have learned over the past weeks, and I have now provided those to other departments across the state of Iowa as we move forward to take on this virus. We've been focused the past weeks on planning and anticipating how best we can support the governor and the people of Iowa as this unfolds. The Iowa National Guard is a large response asset that is capable of scaling our response effort as the conditions on the ground change. The Iowa National Guard is a partner in supporting the lead state agency in this effort. At my headquarters in Johnston, we have stood up our operations center, and we are part of the State Emergency Ops Center. We have brought additional personnel on duty in support of this response effort. Thank you. I'll be followed by the governor.
So before I open the press conference up for questions, I want to reiterate that we do not have all the information at this time. As we are here with you now, many more people are hard at work gathering the information that we need about the current cases to develop the best strategy moving forward. We don't have all the answers, but I can tell you that we are committed to keeping you updated as more information is available. I want to remind the listeners and all of you that a public hotline is open for all Iowans with questions about the coronavirus, and it's available 24/7 by calling 211. Again, 211. It's open 24/7. And I will be providing an update on Tuesday morning during my weekly press conference as well. So with that, we will open it up to questions.
Dr. Scotty, he just has never been on any of the hotspot lists. Can you help us interpret this?
Yeah, again, I'm Dr. Caitlin Padati, the State Epidemiologist and Public Health Medical Director for the Iowa Department of Public Health. You're absolutely right. It wasn't necessarily a part of some of the CDC travel advisories. We still want to emphasize that referring to the CDC travel advisory page is an important thing to do and be familiar with if you're planning a trip. But we also want to share that we've been flexible and responsive to clinician concerns. Again, part of this kind of response, whether we talk about COVID-19, vaping, or any new or acknowledged public health issue, we work very closely with our clinical, public health, and laboratory partners to be flexible in evaluating the needs of Iowans.
Can you describe who should seek out this kind of testing? Was there any update in that area?
Yeah, that's a great question. So when we try and guide testing, whether we're talking about COVID-19 or anything, we want to make sure we're doing this for the right patient at the right time. And we really do rely very heavily on our clinical partners to help assess patients and work with public health to make those determinations. We certainly encourage clinicians to reach out to us. We are still relying heavily on what's known about the epidemiology of this virus and its links to particular travel locations. We're also trying to emphasize clinical presentation, which at this time includes things like fever and cough or lower respiratory illness. And so individuals who are sick with those symptoms and see a healthcare provider with recent travel can have conversations with their healthcare providers, and healthcare providers can reach out to public health if they want to have conversations about potential testing.
Just a handful. I mean, the number of people that have been tested versus how many Iowans we have in the state vary stark, and there's concerns that this has actually been in the community for a long time. How do you? I guess I'm trying to get a better sense. There's going to be a lot of people who are concerned about whether the state is doing enough to test enough people right now.
Yeah, I think it's normal to sort of ask those questions around where do you look and how do you make those determinations. And again, whenever we have something new, we try and start by targeting what we know about it. And that's why a lot of our early efforts focused around travel locations and those links to travel. And we continue to try and focus on those risk factors because they're important. And those are pieces of information we use whether we're evaluating malaria, yellow fever, or COVID-19. But we also recognize that those kinds of epidemiologic risk factors can change over time. And so we've remained flexible and adjusted sort of how we think about patients. We're going to continue to do that as we move forward. But again, I would just say part of the changes in testing and who gets tested has evolved over time, and appropriately so, as our understanding of the virus has evolved over time, and that will likely continue to happen. But again, we want to focus on prioritizing people who have the right symptoms in the right time at the right place. Yeah, so whenever we have, again, whether we talk about COVID-19 or measles or tuberculosis, part of our public health investigation involves both state and local public health working with our clinical partners to evaluate points of contact, how that was done, what protective measures were taken, and then we provide advice on what will be needed. And some of that information just takes a bit of time to gather. We're in the process of doing that now. We're in the process of evaluating whether anybody would need that right now.
And do you know the condition of the 80 that are pending tests?
I don't have that off the top of my head. We've been evaluating patients in a variety of clinical settings, and again, we're looking at a set of symptoms, some epidemiologic risk factors, and coming to a decision, jointly through public health and clinicians on what's appropriate for each individual patient. But I do think it's an important thing to note that there are people who have been able to manage this kind of illness in their homes, and in fact, while we don't know many things about this virus, one thing we have seen is that there does seem to be quite a range of illnesses, with some being quite mild and appropriate for management in their homes. I can provide you with age categories, which is our typical approach here. So we have one middle-age adult, and that's between 41 and 60 years, and two older adults between 61 and 80 years.
And is it singular or plural that they are self-isolating at home or homes?
Again, it's not an important epidemiologic piece of information, so in order to sort of balance patient privacy with what's necessary for public health, we're not sharing that piece at this time.
Much of the conversation in recent days has been, it's not a matter of if, it's a matter of when, and with the map showing all the states around Iowa, within Iowa, kind of an island, were you kind of in an expectation mode that this day was going to come?
I think I can speak for maybe everybody up here when I say we prepare, and this is exactly the approach I think we've taken, is to prepare.
Yeah, we have. We've been working on this. We knew, as we've seen more states added to it, that we needed to be ready to go, and we were. Was one of the reasons that I partially activated the CEOC last week, to make sure that we have communication across all agencies, to make sure that we're coordinating the message, to make sure that we're working with the federal government as well. So not only has the communication between the federal government and the state and then the agencies, but the Iowa Department of Public Health have done a phenomenal job in reaching out and providing information for public health and hospitals and schools and businesses through webinars, especially our long-term care facilities. They have, I said earlier, reached out to each one and tried to make a personal contact. So they've done a great job of really making sure that they're providing the information, the standards, the protocols, make sure that they know that they're a resource for them. And most importantly, I think, just to call. If you do have questions, to please reach out to the Department of Public Health. They have a team ready to go and ready to answer the questions to the best that they can.
Governor, the news release that was sent out from your office says no additional or special precautions are recommended for Iowans beyond, simple precautions. There are other states that are taking much more, are taking other types of actions that are a little bit more, maybe canceling events or.
Well, we're going to assess as we go along, and that's really important for everyone to know that as we learn more information, then we'll reassess maybe what we need to do next. I mean, that's why we partially stood up the CEOC. Now we've fully activated the CEOC. We'll be meeting tomorrow to start, again, just to talk about the coordination and what we need to do. And as more information comes in, then we'll reassess if we need to take additional steps. But right now, we need people to be aware, to understand what they need to do. If you're sick, stay home. As Dr. Padotti said, wash your hands, cough in your shoulder, but most importantly, again, if you're sick, stay home. Don't go out. So
for residents in Johnson County, they're going to see the 3 cases in Johnson
Yep.
County. You're telling them, go about the precautions that we're putting out to the entire state.
Yep.
Is that a bit of a gamble?
Yep. No, we're making sure that they're informed. We're making sure that we have the standards and protocols in place. And if you're not feeling well, stay home, call. They've got a series of questions that the clinicians go through. Call the Department of Public Health, call the hotline. They can go through some of the questions and protocols that they have as well, and then help maybe advise next steps. But right now, until we get more information in, they are self-quarantined at home, and we'll continue to monitor the situation. Is there anything that I need to add to that?
No, I completely.
Okay.
But with, you talked about, Dr. Padati, about some people are more mild, some people are more severe. It is, normal flu season. Just thinking about the people in Johnson County who say, okay, these people were among my community, and they don't know how, they might have contracted it or not. What's your message to them about, there's still a lot of unknowns, it seems like, with how this is transferring to person and those sorts of things.
Yeah, I completely appreciate your question, which is exactly why, and I know this sounds very basic, the advice to do things like wash your hands and stay home when you're sick is so important, because that helps protect you against a variety and range of illnesses.
Should people be calling the clinics if they have cold symptoms before going into a clinic? Is that something that's important to do?
Yeah, our advice has been that if somebody is concerned about this particular illness, that they call ahead to their healthcare facility if they have fever and cough or breathing problems.
What about, you said some people this is very mild symptoms, that was very mild symptoms. So what if they think they're not super sick and they go out and infect a bunch of other people who are a lot more vulnerable? I just don't know at what level should the symptoms rise to that someone goes to their doctor?
Yeah, again, I think you're asking great practical questions. Certainly, I would always encourage anybody who's concerned about their health to reach out to their healthcare provider. I would never discourage anybody from seeking care. But again, I would also say, and I know I sound a bit like a broken record, that's why it's so important, whether we're talking about COVID-19 or flu season or anything else, if you don't feel well, stay home and away from others, because we know this virus moves from one person to the next when we're in close proximity to each other. And if we take away its ability to do that, then we limit the spread.
But there's some people who can't take off work because they're sick and they're shift workers, or, how do they assess, maybe someone would take the time if they really feel ill.
Well, they just need to stay home, and that's what we need to say. And they have reached out to businesses. I think businesses are aware. In order to try to contain this as much as we can, Dr. Padati has walked through a process and a standard that, Iowans should try to follow, and that's what we need to do until we can continue to assess the situation, get a better understanding. These are tied to a cruise in Egypt, so we know, where this came from. And so I just think until we can have additional information, and we're going to update you as soon as we get it. So I will be giving updates at the press conference on Tuesday if we learn anything prior to that. I don't know if you guys are doing a press conference tomorrow or not. I don't know. No. So, but as we have more information, we'll make sure that the public is be made aware of that.
And you will confirm that these were the only 3 Iowans who were on that cruise, or were there other Iowans?
They're still assessing all of that information, so as soon as we have additional information, we'll let you know.
The silica today in the passing of the peace didn't do it. They bumped elbows. What's your recommendation to houses of worship and, sometimes communion isn't done in different ways?
Well, so in my church, which I go to the Lutheran Church of Hope, we're doing individual cups. We're not dipping. So everybody, we talked about fear and really being mindful about your surroundings and how we move through this and not letting fear, take over. We need to be reasonable. We need to do the right thing. And we just need to be conscientious not only of our own health, but, different things that we're participating in. So we'll continue to, as I said, we'll continue to keep the public updated as we learn more.
What is Iowa's capacity? How many customers?
We have 500 right now. So we had 250. We got another 250. We're also, as I said earlier, there's great coordination among surrounding states. And we have other resources, but right now we're in fine shape.
I want to make sure I understand that, the 500 people, is there a specific capacity per day of that? And then obviously we've got,
37.
Right now, so as of right now, going into Monday, what is the state's capacity on the daily? And has that 500 actually dwindled because we've done some testing?
So the 500 would be less the 37 that have been done. And, you know, we've been, our partners at the State Hygienic Laboratory have been performing this on a daily basis for us. And, you know, we're very grateful to them for that partnership and for their ability to do that. And as you heard Governor Reynolds mention, as we move along and as we continue to respond, you know, if we had concerns, we'd be working with them, with our laboratory partners regionally and nationally to address that if we needed to.
And just to be clear, I know you talked to state lawmakers, maybe a week and a half ago, and you were saying that Iowa didn't have the ability to test yet, and we do now.
No, as of February 27th, we were, the State Hygienic Lab was able to perform the
There's no
test.
concern over like the fault, 'cause I know the previous test kits were faulty or something like that, if I'm remembering, or like having.
Well, do you
some
want to talk about the
problems.
CDC, what the mechanism is to
Yeah,
answer that
I
question?
think you're talking about what some of the challenges in the validation process where there are no longer any concerns with the validation process. Our lab is able to perform that testing, yeah.
What's the difference between presumptive and confirmed? I know we'll get questions about that.
Yeah, it's got to do with how each lab kind of initially will have laboratory tests confirmed with the CDC. So each lab goes through a presumptive positive confirmation process. And then after doing a few of those, it's no longer necessary. Just another way to ensure quality.
Okay, thank you very much. Thank you.